Hi everyone, Dr. Mike here. In this video, I'm going to answer the age-old question, what the hell is an electrolyte and why do we need them? So the answer to the question is pretty simple. An electrolyte is the medical term for an ion. Now your question might be, what is an ion? An ion is a charged atom or element. So this should bring you back to memories of sitting in the chemistry classroom, looking at that giant poster of the periodic table. Remember, the periodic table is the ingredients list to make everything in the universe, including you and I. If I did want to make a human being from scratch, I would only need 59 of the 118 elements sitting on that periodic table. In actual fact, I only need 6 of those elements to make around about 99% of you. But what I want to talk about is those 59 elements. Of those 59, some of them remain in the neutral form that you see on that periodic table, which means they have no charge associated with them, but there will be a subset of those 59 that need to be charged. Now, some of them may have a positive charge, some of them may have a negative charge, and it's this charge associated with these atoms or elements that we call ions, that we actually need to maintain certain and very important physiological functions within the body. So, first thing I want to talk about is exactly what are some of these ions and how do they come about. So, some of the most important ions you need to be aware of include that of sodium, which is Na+, chloride, Cl-, potassium, K+, magnesium, Mg2+, and calcium, Ca2+. There are others, including hydrogen ion, bicarbonate ion, for example. But these are some of the most important ones I want to talk to you about. So I want to talk about the periodic table, and the question I get asked all the time from students is, why is sodium Na+? And why is chloride Cl-? Why is magnesium 2+? And calcium 2+, for example. What makes an ion have a positive charge? What makes an ion have a negative charge? And how do we know whether it's going to be 1 positive or 1 negative or 2 positive, for example? Well, let's take a look at that periodic table. First, let's look at sodium. Sodium is number 11 on the periodic table. Now, if you have a look in the top left corner, generally you'll see something called the atomic number. The atomic number will tell you how many positive protons sit within the core of that atom. So 11 tells you that there's going to be 11 positive protons. Now, because these atoms are neutral, we need 11 of something negative to balance it out. And these negative things are electrons, and they fly around the outside of the atom. So what I'm saying is that sodium, in its neutral form on the periodic table, has 11 protons and 11 electrons. Now, the thing is that if you were to compare this to something like chlorine, chlorine is what number? It's number 17. So you can see the atomic number there. So it's going to have 17 positive protons in the middle and 17 negative electrons flying around the outside. Now, we know that sodium actually wants to have a positive charge, chlorine wants to have a negative charge. How does this happen? We now need to have a look at something called the noble gases. So you can see on the far right-hand column of the periodic table, you have a line of elements that we call the noble gases. Noble for a reason, because they think they're the best. And in actual fact, the other elements are convinced that they are the best, and they want to be exactly like those noble gases. So for example, sodium wants to be like its closest noble gas, which is neon. Now, if you have a look, neon has a number, an atomic number of 10. So how can sodium be like neon? Well, let's think about those protons first. Those protons of a positive charge are locked away in the core of that atom. You can't, unless you're a sun, you can't really play around with them. But what you can play around with are the electrons flying around the outside. So how can sodium, that has 11 electrons around the outside, be like neon that has 10 electrons around the outside? It's simple. Sodium can give one of those electrons away. And if it does give one of those electrons away, what do you think it's left with overall? It's left with 10 electrons, but 11 protons. So there's a net charge of 1. So sodium will be Na+. Let's take a look at chlorine. Chlorine which has 17 protons and 17 electrons, wants to be like its closest noble gas, which is going to be argon. Argon has 18 protons and 18 electrons. How can chlorine be like argon? Well, it can gain an electron. And if it gains an electron, it's going to be Cl negative. But the question is, when sodium wants to give away an electron and chlorine wants to obtain an electron, where do they get these electrons from and who do they give these electrons to? Well, sodium and chloride, if you think about it, that's a beautiful relationship right there. Sodium wants to lose an electron, chlorine wants to gain one. So in actual fact, you can create a relationship between these two where sodium and chlorine come together and sodium gives chlorine that negative electron and chlorine shares that negative electron with sodium and we get something called sodium chloride, which we term salt. Now, sodium chloride, that salt, is actually an electrolyte. So we term sodium chloride an electrolyte. Now here's the thing, there's no charge for sodium chloride, right? Because the sodium is given its negative electron to chlorine and chlorine has taken that negative electron away, but you can see that together, it's all balanced out. Now the thing is that when you put sodium in what we call the universal solvent, which is basically just water, what happens to it? You take sodium chloride and you drop it in water. Well, let's take a quick look at water. Water being the universal solvent is an amazing substance. We know that water is made up of H2O. There's 2 hydrogen and 1 oxygen. And it's shaped like a boomerang. So you've got the oxygen like this, and you've got the hydrogen like this. And in actual fact, the hydrogens will have a slight positive charge, and the oxygen will have a slight negative charge. This is important. What do you know about charges? You know that a negative charge will be attracted to a positive charge, and a positive charge will be attracted to a negative charge. And therefore, if you have water, the negative oxygen is going to be attracted to anything that's positive, and the positive hydrogen will be attracted to anything that's negative. Interesting. So if this whole solution is this water, and you've got sodium chloride being dropped into it, the water pulls them apart, right? And what you end up getting is the individual sodium will have that positive charge, the individual chloride will have that negative charge, but that's okay because the negative oxygen of the water will bind with that sodium ever so slightly, and the positive hydrogen of the water will bind ever so slightly to that of the chlorine. Now, this is important because a relationship's now formed. It's not an extremely strong relationship like it was with the sodium and chloride, but it is a strong relationship in bulk, in high quantities and high numbers, because wherever these ions go, water's going to follow. That's the main function of having electrolytes in the body. Electrolytes, like sodium chloride, are basically just salts that when you drop into water, they split apart to form charged atoms or elements that we term ions. And the function of these ions is they dictate where that water goes. So let's now take a look at what's happening inside of a cell, right? If we were to take a cell and have a look at the different, so let's take a look at these. So here's a normal cell. What we know is that most of the sodium is located outside the cell. Most of the potassium is located inside the cell. Most of the chloride is located outside the cell. And what we're going to find is most of the magnesium is located inside the cell. Most of the calcium is located outside the cell. And there's actually other ions that you can have a look at. So for example, there's a lot of phosphate inside the cell. There's a lot of negatively charged proteins inside the cell as well, to be honest. And there's also going to be bicarbonate sitting outside the cell. So as you can see, there's a distribution. And I'm going to wipe these ions off the side here. There's a distribution difference of which ions are located where inside and outside the cell. Predominantly sodium outside, predominantly potassium inside. Now the thing is, if you look at a textbook, you'll find that positively charged ions are called cations and negatively charged ions are called anions. The way I remember it is I like cats, so they make me feel positive. So cations. If you don't like cats, that's not a very useful way to remember. So let's look at this now. If I were to add up, here's the thing. If I were to add up all the sodium, most is outside. If I were to add up all the potassium, most is inside. But if I was to add up the overall concentration of ions outside and the overall concentration of ions inside, it is going to be a similar concentration. That concentration is around about 300 milliosmoles. Both inside and outside, around about 300 milliosmoles. You might be thinking, what the hell is a milliosmole? It's simply the measure of concentration of these ions. Now, I told you before that ions are really important because they dictate or determine where water goes. That's what this milliosmoles is referring to. Osmoles is referring to osmolarity, osmolality, which is the capacity of a substance to pull water towards it. And the point I'm trying to make here is this. If I were to change the concentration of any of those inside or outside, it's going to change the osmolarity. So if I were to increase the osmolarity outside, let's take it from 300 to 320, I've now got a higher concentration of ions outside, whichever ions those may be. But what this truly means at the end of the day is I now have a stronger pulling force for water to go towards the outside than towards the inside of the cell. And if that's the case, water will be pulled outside of the cell. Now, if water's pulled outside of the cell, what do you think what happens to the cell? It dehydrates, and you get intracellular dehydration. Now, the opposite is obviously going to occur if I were to change the concentration of the ions inside and make that go up compared to outside. Then what do you think is going to happen? Water will be pulled inside of the cell. You end up getting extracellular dehydration, and that cell will swell. Now, the term we use for this relationship of the water moving inside and outside the cell determined by the osmolarity is the tonicity of a cell. And you've probably heard the term isotonic. You've got hypertonic, you've got hypotonic, and you've got isotonic. If you read one of those electrolyte drinks, you might see that it says isotonic solution. That's saying iso means same. Tonic means the concentration in osmolarity. So it's saying that the drink is the same osmolarity or concentration of ions as your body, which is telling you that it's not going to influence the water going inside or outside of your cells at all. It's going to maintain your fluid balance inside and outside of your cells. But if you have a solution that's hypertonic, think about it. You ingest it. Whether you drink it or you put it into your veins, for example, that doesn't go straight into your cell. Remember that your bloodstream is synonymous with all the fluid outside of the cell. So whatever you drink or whatever you put in your blood vessels, it's then going to move out of your blood vessels and bathe your cells. And so if that's a hypertonic solution, for example, it means it's going to be greater than around about 300 milliosmoles. Again, let's say 320. That means, like we said earlier, water will move out of the cell and dehydrate it. That's not good for cellular function. If you ingest a hypotonic solution, the opposite will occur. Does that make sense? Hopefully it does. So at the end of the day, the point I'm trying to get across is the purpose of us having ions and the purpose of us having ions distributed outside and inside the cell is that it controls fluid balance. It determines which way that water is going to go. Let's focus on two really important ions, sodium and potassium. So most of the sodium we know sits outside the cell. Most of the potassium we know sits inside the cell. The reason why this happens is because there's something called a sodium-potassium ATPase pump. There is a pump that sits in the wall of these cells, and its job is to throw 3 sodium outside of the cell and exchange it for 2 potassium. So 3 sodium go out, 2 potassium go in. And it does this using ATP, so energy. So it's called the sodium-potassium ATPase pump. It is what creates the gradient of sodium outside and potassium inside. Very important. Very important. And it's important for a couple of reasons. I'll tell you why. Look at the charge associated with it. At the end of the day, we've got 3 positive things outside, 2 positive things inside. So that means if I were to look at this cell, it's going to be slightly positive outside compared to inside. All right. But the other thing is this. You probably are aware of a process called diffusion. This is where if you have a high concentration of something on one side of a membrane and a low concentration of that something on the other side, it wants to balance itself out. Concentrations love to balance themselves out in nature and in biology. When you take a tea bag, there's a high concentration of tea in that bag and you dunk it in the water, what happens? There's a low concentration of tea in the water, so it diffuses out of the bag to try and balance the concentration out. Over time it will. The concentration of tea in the bag and outside the bag will be equal. That's diffusion. Same thing wants to happen here. That sodium wants to come inside of the cell and this potassium wants to go outside of the cell. Now the thing is, it can't, because all cells are surrounded by a phospholipid bilayer, a membrane that is covered in fat. And this fatty membrane does not like anything that's large and it does not like anything that's charged. Now the thing is, sodium and potassium, they're not large, but they are charged. So they can't freely move in and out. So in order for them to do so, they need channels. Now, there are no channels in this cell that's going to freely let the sodium go in. However, there are going to be channels that freely let the potassium go out. And it's a leaky channel, which means the door for this channel is just slightly open. And so this potassium will slowly leak out. Now, potassium has a positive charge. It's going to take that positive charge with it and make the outside of the cell slightly positive again compared to the inside. Now, what I'm trying to get across here is this. The ions of sodium and potassium are really important for creating a charge difference across the membrane of certain cells. Not all cells, but certain cells. What cells are they? They are what we call excitable cells. Specifically, excitable tissues of the body. What are excitable tissues? Well, examples of excitable tissues include nervous tissue, so neurons, include muscle tissue, which allow for us to move, and include endocrine tissue that release hormones. All of these 3 tissue types can be at rest and not do anything. A nervous tissue at rest doesn't send a signal. A muscle at rest doesn't contract, and an endocrine tissue at rest does not release a hormone, but it has the capacity to do something. And that capacity to do something is the excitability of it. A neuron has the capacity to send a signal for communication. Muscle has the capacity to contract for work to be performed. And endocrine tissue has the capacity to release a hormone so that something can be done. And in order for that to happen, we need to have a charge difference from inside of a cell to outside of a cell. Let's just say that this cell is an endocrine cell. There's a hormone sitting inside of this cell waiting to be released. But at the moment, it hasn't been excited to release yet. At rest, what we need for a cell, at rest, not when it's excited, at rest, we need the sodium-potassium pump to set up a concentration difference. We need a leaky potassium channel for the potassium to leak out. And in doing so, we have a slightly positive charge on the outside of this endocrine cell compared to inside. Now, the scene is set. This charge difference is called the resting membrane potential. It's at rest. It's across the membrane and it has the potential to change. So how do we change it? Well, simple. There's certain channels embedded in the walls of these cells specifically for sodium. but they're closed, right? The lid is shut. But let's just say I want to release this hormone. I need a stimulus, a signal. So something's going to stimulate it. It could be a drug. It could be some form of nervous innervation. It could be whatever it may be. It stimulates this cell to open up these sodium channels to let the sodium in. Why would the sodium come in? Because it's going down its concentration gradient. Diffusion. And sodium will bring that positive charge with it, making the inside of the cell positive. It's now changed it. This excites the cell. This positive change inside results in a whole cascade effect that then will push this hormone out. And now that hormone's out, it can travel through the bloodstream to do what it needs to do. This is synonymous, which is what's going to happen with muscle. When the positive sodium goes in, it doesn't release a hormone, it tells the muscle to contract. For nervous tissue, when the positive sodium goes in, it tells it to send an electrical signal. So the other important point you need to understand about electrolytes and ions is they help us maintain nervous tissue, muscle tissue, and endocrine tissue function. So what are the big important topics you need to understand for electrolytes and ions? 1, they maintain our fluid balance. 2, they maintain excitable tissue status, being that of nervous tissue, muscle tissue, and endocrine tissue. And the most important ions you need to be aware of are sodium, potassium, magnesium, chloride, calcium, hydrogen ions, bicarbonate ions, and phosphate. I hope that helped. Hi everyone, Dr. Mike here. If you enjoyed this video, please hit like and subscribe. We've got hundreds of others just like this. If you want to contact us, please do so on social media. We are on Instagram, Twitter, and TikTok at Dr. Mike Todorovic, at DrMiketodorovic. Speak to you soon.